Hi guys, this is Patience, and actually I am here to do my follow-up video. Guess what? I have some awesome news, and let me just start because I have lots of new subscribers who are watching my channel, and I'd like to say I am, what is this, October? I am 22 months post lap band surgery. Who'd have thought I'd be 2 years out and where I am today? I had my lap band surgery on November the 19th of 2009, and my highest weight at that time was 315 pounds. Well, the day of my surgery, I had lost 30 pounds when I was down to, what was I down to? 285, something like that. And I lost it just with diet and exercise because, guys, I was so ready to make a change in my life and be healthy. I was very eager to make that adjustment. And I go back and look at my pictures now, and I can't believe that is me. Um, so, I'm here today to give you an update on my plastics. Yeah. And I wasn't sure a couple of weeks ago if it was going to happen or not. I think you've heard me say that if it didn't happen, I'm okay with that. And if it did, hey, I'm very, very excited. So guess what? I'm very, very excited. And I've chosen a doctor, and I think I have a tentative date for my procedure. It will be finalized next week. Um, yeah, because I have some things to do. Let me just tell you a little bit about my doctor, just why I decided to go with him. And first of all, his name is Dr. Licenberg. He is based out of Dunwoody, and the way that I got connected with Dr. Licenberg was my lap band surgeon referred me to him. He was like, everybody who goes there is very pleased with his results, and so is he. And another thing is that he practices um, at at the hospital where my doctor goes. So if my port needs adjusted or something, Dr. Steinberg can come in, I guess, and do it. Or they work together. If Dr. Steinberg trusts him with his patients, that was the number one thing for me. And yeah, so let me just tell you. I know you guys heard me talk about the procedure that he wanted to do. And the procedure that he wanted to do on me was called the fleur de lis, which is a T incision. When I say a T, I mean it goes down the middle from underneath the breast line down to past the navel until where he makes the cut to take off the paniculate, the pannus, or that fat overhang that's on the bottom, that what I call my bottom belly, but in medical terms it's called the pannus. And they cut that off, and that's it. So the purpose of the middle incision is to give you a clearly more defined waist, and he also um, deals with the abdominal muscles. Yeah, he fixed those as well. So I was kind of apprehensive about that because not too many people discuss that. I don't know. I think it's maybe not a standard procedure that everyone goes to get because I think it's somewhat very more extensive than a regular abdominoplasty where they are paniculectomy, because you do have multiple incisions and people are kind of afraid of the scars, like myself. Um, well, it wasn't the scarring, it was the pain and just the results of the surgery itself. So I've been communicating with the doctor's office several weeks since my last video, and they have been like amazing. I cannot express. I mean, being a nurse, coming from the medical world, I've seen doctors and doctors' offices with bad patient communication, that everything. And no matter what question that I had, no matter how minor, how little, or how many times I've called them to ask this question, they have always been attentive. And if there's something that I don't understand, they're like, well, come talk to Dr. Licenberg about it. He is open. His office is here. He's here to help you. And I mean, I have just been blown away the past couple of weeks. Well, what drove me to make my decision, because I've been poking around, not really making a decision. It's really what's been holding me back because I want to make sure that I'm doing the right thing. So I called last Friday to go over how much money I was gonna need and um, and all of those things. So when I called, I was like, Sam, she's the scheduling person. I said, I'm really having issues with the scar and my recovery because I had to get back to work. And she said, okay. She said there's a young lady who had a procedure done in April. And I was like, really? She said, would you like to talk to her? I was like, absolutely. So she gave the young lady my number and she called me. And her surgery was far more extensive than mine because she had a lower body lift along with the floor de lis. And when I tell you her results are unbelievable, they are unbelievable, people. Unbelievable. And I was saying, well, why did you choose Dr. Licenberg? And she was like, the same reason that I'm choosing him is because his pictures that he specializes in bariatric patients. He do mommy makeovers, but not most of his patients are bariatric. So he deal with fat skin all day long. He don't deal with somebody with, with maybe a 13-20% body fat percentage. He deal with people with actually skin problems, big, thick skin such as mine. So I was like, wow. But guys, when I saw her pictures, I was like, sign me up. She said she absolutely loved her results. And the scar doesn't really matter. And she was talking how about Dr. Licenberg was a perfectionist, and he told her once he got in there, if he had to do more, he was gonna do it without her, because he looks at you as a piece of work of his, and he wants to put the stamp on it. So if he gets in there and you need lipo, he's gonna do lipo, or he's gonna do whatever that's gonna make your body look right. And guys, I'm telling you, I'm gonna put her link. She blogs on obesity help. Very nice young lady, and he did like a fat transference for her breasts, but I won't be doing that. I can't afford all that. Barely can get in this tummy tuck with him, but she was like, I know he's expensive. She said, but the money is so worth it, and you will be so happy. So I saw pictures of her before and after. She was like, which Sam told me that, everybody results are different, but she is a little shorter than I, and she had a little more, her shape was a little different than mine. So my results are going to be way different than hers, only because she said, just in my body shape, it's going to be way different. And she said, anyway, but guys, words cannot describe how this girl looks amazingly. She had it done in April, and so I'm excited. So where am I in my thing? I'm going to try to put a link to hers just so you can check it out. And if you have time, just look up the fleur de lis. It's a real interesting procedure. So I saw a video when he first told me about it, and I was like, oh hell no, can't do that. But with her results, hey, I'm not gonna wear a bikini anyway. But who cares? I still might with a scar down the middle. Uh, but so So Sam was like, this was the end. She's like, okay, she's like, so when are you looking to have it? She said, I got a day open, November the 22nd. We're waiting on one more thing to confirm my date. And once we get that, she said, for sure, Monday, I am going to know what my surgery date is going to be. Because, of course, I had to put $1,000 down to reserve my surgery date. So once I get everything in place, then we are going to do that. And so that's exciting. So maybe Monday or Tuesday, I'll have an answer from you about my surgery date. About you or for you? For you. So she gave me a list of labs that I need to have done prior to me going. And Dr. Licenberg requires that you do like nutritional supplements 3 weeks before your surgery to get your body ready. And I'm also going to be doing things on my end to get my body ready, like taking my vitamins. Even though she said I don't have to lose 10 pounds, I'm going to try to lose 10 pounds before my surgery date. The day that she told me she's tentatively penciling me in for was December 6th. Yes. So, yeah, December 6th. Can you guys freaking believe that? December 6th. So, I'm gonna see my primary care doctor next week, and I know I have an abnormal EKG, so I'm gonna go ahead and try to get my cardiology clearance. And yeah, hopefully everything's gonna go smoothly. I had to, because I had to get my money right. So if you guys don't see me, or if you see me or if you guys see me and I look a hellified mess and a hellified tired, it's because I'm on a hustle, guys. I am very much on a hustle to get this money to do this. So basically, within the next couple of months, if somebody called me to come to work, this sister will be in there. Tired, no sleep, no whatever. I will be nursing. Okay? Yeah, nursing is a hustle. I don't know if you heard people say that, but to be a nurse, you have to hustle. I mean, it's a great career, but you have to enjoy it, but it's also a hustle. It's nothing easy about nursing, but um, the money's good, especially if you hustle. And you can hustle to do just about it. Anyway, that's a different tangent about nursing. But anyway, so I have a list of labs that I need to get, which I get those done. And of course, I know my thyroid's going to be off because I've been awful taking my medicine. But I was saying I'd like to get my weight down, probably about 10 more pounds, even though they don't think I need to lose any more weight. I like to get my weight down just so, because I know once I get my band deflated, I'm going to gain weight. And so that's where I am, and thanks to everyone. I'm telling you, I am so, so, so excited. And I'm gonna do a body shot, not today, maybe later today, but not right now. So you guys can see exactly how my body is 14 months, 22 months post-op after losing 155 pounds now, because I'm down to 160. So, and I think, anyway, so I hope you guys have a great weekend, and I will talk to you soon, hopefully Monday, with a great update. Thank you.